And joining us now, Dr. Anthony Fauci, the government's top official on infectious diseases. And Doctor, welcome back to Fox News Sunday.
Good to be with you, Chris.
I want to start with those videos that Kristen Fisher just showed of those thousands of people at airports overnight rushing to beat the travel ban, waiting online for hours. You can see them here in close proximity, one assumes, coming back from Europe. Some of them have the coronavirus. As an infectious disease doctor, are you troubled seeing this?
Yeah, I mean, we'd like to not see crowds like that. I mean, I think what people need to understand, if you're an American citizen, if you are a family member, that you can get back. You don't need to rush back. You'll be able to get back. But it's understandable how when people see a travel ban, they immediately want to hunker and get home. Hopefully, we don't have more of that, but I think we probably, unfortunately, will see that.
And is that a problem in terms of the spread of the disease?
I mean, obviously, whenever you have crowds, I mean, that's the thing we've been talking about and that we really want to implement, is to have that kind of social separation. That is countermanding that, and hopefully that people will understand you don't have to rush back.
And to what degree is it on the airports to prevent that and not have those big crowds of people waiting for hours?
I don't know, Chris, what the airports can do about that, to try and encourage people, to tell them that if you are an American citizen, you will be able to get back. It's not going to be a problem.
You testified before Congress this week, and you made, I think, what most people would consider some pretty chilling comments. Here they are.
Bottom line, it's going to get worse. The flu has a mortality of 0.1%. Sure. This has a mortality of 10 times that.
What's different about this virus? What's different in how contagious it is and how lethal it is?
Well, I would say three things, Chris. One, it's brand new, so we don't have any prior experience about what it's going to do, what its dynamics are going to be. Number two, it spreads very easily. There's no doubt about that. It isn't like some of the other outbreaks that we had that just didn't adapt itself to spread among humans. And number three, it's very serious in the sense of morbidity and mortality, particularly among and very heavily weighted towards individuals who are more susceptible, the elderly and those with underlying conditions.
And in terms of contagiousness and lethality, worse than the flu?
Well, yes. I mean, it just is. And we've got to face that fact. We've got to be realistic. I mean, we've got to realize, and I said that at the hearing, that things are going to get worse before they get better. But the kinds of things we're doing now will hopefully mitigate that. You know, I showed that curve, that peak.
We're going to talk about that.
But that's important, because to think that right now everything is going to be okay if you don't do anything, that's absolutely incorrect. We've got to really always be ahead of the curve. I mean, I say now in a way that people can understand, I'd like to be the fact that we're criticized for being overreactive. Because when you're dealing with a virus outbreak, you are always behind where you think you are. So therefore, you've got to jump ahead and stay ahead of the curve.
I want to ask you about this. On Friday, both you and the president at one point mentioned 8 weeks.
Yeah.
Now, you weren't saying it's all going to be over in 8 weeks, but are you suggesting that if we do everything right, that we could be on the other side of the curve in 8 weeks?
The answer, first of all, we have to say that people don't misunderstand. We are not sure what the duration is going to be. Number one. Number two, if you look at what happened in China, where they had that peak and then they are coming down. There were only 11 new cases in China. They dominated the new cases just a few months ago. So if it started off in China, 2 or 3 months ago, they started coming down within a 2-month period. So if you're talking about reflecting what went on there, it's going to be about that time that we hopefully in the next couple of months are going to see the direction it's going to go. Hopefully what we're doing in a very aggressive way of containment and mitigation will be able to not only flatten it in the sense of not as many cases, but also diminish the duration.
President Trump announced a public-private partnership on Friday and made it sound like serious testing around the country that we'll be seeing it soon. First, there was this.
I want to thank Google. Google is helping to develop a website. It's going to be very quickly done, unlike websites of the past.
But Google's sister company, Verily, put out a statement later that said this test, which according to him and other officials, first of all, will let you sort of check whether your symptoms indicate you have it, and two, if you do seem to have it, we'll tell you where you can get testing. In fact, is just starting and is just in a pilot program for the Bay Area, and that it's going to take over time, they said, for it to be applied nationally. And while the president made it sound like mass testing is going to start very soon, there are a lot of experts who say that whether it's staffing, public health staffing, or the products or the chemicals needed for mass testing, that we're way behind the curve on that. So I guess my question is, how soon can people across the country expect mass drive-through testing?
Okay, so there are two issues here, Chris. There's a website and when it's going to be fully open versus the availability of testing. They really are somewhat separate. So put aside the website and how it's going to be fully operational. The CEOs of the companies that we had at the White House, that the president met with, it's very clear that when I specifically asked them, when can we get started to start doing this, where you can really have availability in a much easier way, implementing, not just saying that it's out there. They're telling us that that will be starting up within the next week or so, that it's going to go up. Now, in the reality, there are going to be people a week from now who are going to say, I tried to get a test and I couldn't get it. But the totality of the picture is going to be infinitely better than it was a few weeks ago.
I want to talk to you about a few weeks ago, because there are continuing questions about why other countries, South Korea may be the best example, are testing thousands of people a day. And so far, the CDC says that it and state labs total, the whole crisis, have tested 13,000 people. Here's how you and the president answered questions about the testing lag this week.
The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
No, I don't take responsibility at all, because we were given a set of circumstances, and we were given rules, regulations, and specifications from a different time.
The president says the Obama administration set up rules and regulations that made it impossible to do testing. You were in the same position under the Obama administration. Is that true? Is that what stopped it?
You know, Chris, to be honest with you, I'm not sure what regulations and when it was that they're talking about. I really mean that. I mean, I'm trying to figure out what it is that these things were in place that were able to or inhibiting. But one thing that I do know now is that the ability to get a test had some regulatory and other restrictions on it, but the FDA now has just gotten rid of. I mean,
they could have done that at day one.
Well, yeah, they could have, but the fact is it wasn't. So I tend to like to, instead of looking back, look at where we're going.
All right. You talk about slowing the virus down. You talk a lot, and I've gotten very used to this now. You could either have a bump like this of cases, or you could make it maybe the same total cases, but it's a much more gradual and slower and longer curve. I want to put up some numbers. We have in this country about 950,000 hospital beds and about 45,000 beds in intensive care units. How worried are you that this virus is going to overwhelm hospitals? Not just beds, but ventilators. We only have 160,000 ventilators. And could we be in a situation where you have to ration who gets the bed, who gets the ventilator?
Okay, so let me put it in a way that it doesn't get taken out of context. When people talk about modeling where outbreaks are going, the modeling is only as good as the assumptions you put into the modeling. And what they do, they have a worst case scenario, a best case scenario, and likely where it's going to be. If we have a worst case scenario, we've got to admit it, we could be overwhelmed. Are we going to have a worst case scenario? I don't think so. I hope not. What are we doing to not have that worst case scenario? That's when you get into the things that we're doing. We're preventing infections from going in with some rather stringent travel restrictions, and we're doing containment and mitigation from within. So at a worst case scenario, anywhere in the world, no matter what country you are, you won't be prepared. So our job is to not let that worst case scenario happen.
And final question. 3 countries now in Europe, Italy, Spain, and France, are basically in total lockdown. People not allowed out in Italy. I think only pharmacies and grocery grocery stores are open. You see people on the balconies singing songs and banging pots. Could that happen here, either nationally or in some regions? And what about the possibility that we might have to have travel bans inside the country?
Well, a couple of questions there, so let me take one at a time.
Yeah.
The idea of what's going on in Europe is that they got into that escalation phase. So what they're doing now is playing catch up. We feel that with rather stringent mitigation and containment, without necessarily complete lockdown, we'd be able to prevent ourselves from getting to where, unfortunately, Italy is now. With regard to domestic travel bans, we always talk about and consider everything, but I can tell you that has not been seriously considered, doing travel bans in the country. Would it might be sometime? We always leave an open mind.
Dr. Fauci, thank you. Thanks for coming in. An awful lot of people are relying on what you have to say, and of course we'll be tracking what the President's task force does this week. Thank you, sir.
Thank you. Good to be with you, Chris.